Hi, this is Dr. J. Park with Cosmetic PRP Training.com. This is a PRP and PRF instruction manual for medical professionals. So, all right, let's jump right into the exciting part of aesthetic medicine today. PRP, platelet-rich plasma, and PRF, platelet-rich fibrin, are autologous treatments. What does that mean? It means we're using your body's own resources, specifically blood derived products, to promote healing and regeneration. In simple terms, we're pulling platelets and, in case of PRF, leukocytes, and injecting them into targeted areas to do what they do best: repair, rejuvenate, and regenerate tissue. PRP is packed with platelets floating in the plasma. PRF takes it a step further by mixing those platelets with leukocytes in a fibrin matrix. This combination is a goldmine of growth factors and cytokines, critical components for healing and tissue repair. So, what is PRP? PRP is a concentrated version of your blood plasma loaded with 3 to 5 times the number of platelets found in your bloodstream. When we inject PRP, it releases growth factors like platelet-derived growth factors or transforming growth factor beta and vascular endothelial growth factors. These are big players that tell your body, hey, it's time to rebuild some tissue. PRF takes this to the next level. It's a second generation platelet concentrate that creates a fibrin matrix. This matrix holds platelets and leukocytes in place, providing a steady release of those same growth factors, but with a longer lasting effect. Unlike PRP, PRF doesn't require any anticoagulants and is a much simpler process with a single centrifugation. You get a slow release of growth factors that keeps healing happening for a longer period. Application for PRP and PRF is as follows. In aesthetics, we use them to treat fine lines, wrinkles, acne scar, and hair loss. In orthopedics, we use them for healing injuries like tendonitis, ligament damage, and osteoarthritis. It is also used in wound healing for accelerating the repair of chronic wounds. And in dental, we can use them for enhancing bone regeneration and soft tissue healing. PRP and PRF just didn't show up yesterday. The concept goes back to the 1970s when PRP was first used in cardiac surgery to cut down on bleeding. By the 90s, it made its way to orthopedics and sports medicine, and by the early 2000s, PRP was everywhere in the world of aesthetics. PRF became a more advanced version of PRP a decade later. Think of it as PRP 2.0 with a fibrin matrix that keeps healing going on for longer and add versatility to its application. Now, if you're working in an aesthetics practice, this manual is your go-to guide for everything PRP and PRF. We're covering the science, the how-to for preparing and applying these treatments, patient management, and best practices. This isn't just about theory, it's about applying the latest research to get real measurable results for your patients. Scientific principles and mechanism of action. Blood isn't just some red liquid running through your vein. It's got layers to it, so let's break it down. Red blood cells, these are your oxygen carriers, deliver oxygen from your lung to your tissues, picking up carbon dioxide for the return trip. White blood cells are your body's defense mechanism. Neutrophils, lymphocytes, and the likes, they fight off infection and help with tissue repair. Platelets, these little guys are critical for clotting and healing. They're packed with growth factors and other goodies that speed up repair process. Plasma is the liquid that holds everything together, carrying proteins, nutrients, hormones, and waste. Inside platelets are alpha granules and dense granules, which are like tiny storage units filled with growth factors and cytokines. Once activated, they release their content, kickstarting healing and tissue repair. Leukocytes are your body's immune response. Neutrophils are especially key players in the inflammation phase, helping the healing process of your body. Mechanism of PRP and PRF. We draw blood and spin it down to separate out the plasma and concentrate the platelets or form a fibrin matrix. PRP goes through a double spin to pack more platelets, while PRF only need one spin. Platelet activation. When PRP or PRF is injected, the platelets are activated by exposure to the tissue. This causes the platelets to release growth factors like PDGF, TGF beta, DEGF, and EGF. These growth factors trigger the body's healing response. Once released, these growth factors get to work, stimulating cell proliferation, collagen production, blood vessel growth, and overall tissue repair. PRF sets itself apart by forming a fibrin matrix, which acts as a scaffold that holds on to the platelets and leukocytes, allowing for sustained release of growth factors. This scaffold supports cell migration and integration, making tissue repair faster and more efficient. Indications and contraindications. Here are the indications for PRP and PRF. Skin rejuvenation. PRP helps rejuvenate skin by promoting collagen production, reducing wrinkles, and improving texture. It's often paired with microneedling or laser treatment for even better results. Hair restoration. PRP has shown great results in treating hair loss. It stimulates hair follicles and boosts hair growth, but multiple sessions are needed for best results. Acne scars. When used with microneedling or laser treatments, PRP can help significantly reduce acne scars by boosting the skin's natural healing processes. Stretch marks. PRP helps reduce stretch marks by encouraging collagen production and improving skin regeneration. Melasma. Though tough to treat, PRP has potential in improving pigmentation issues like melasma by repairing damaged skin cells. Wound healing. PRP accelerates the healing of chronic wounds and ulcers, reducing inflammation and speeding up tissue regeneration. Orthopedics. PRP's regenerative properties help reduce pain and improve healing in conditions like osteoarthritis and tendonitis. Absolute contraindications. These include platelet dysfunction syndromes, critical thrombocytopenia, sepsis or systemic infection, active infection at the treatment site, and hemodynamic instability or severe chronic liver disease. Relative contraindications include the following: heavy smoking, recent NSAID use, especially 48 hours before treatment, cancer, autoimmune diseases, or uncontrolled diabetes, recent surgery, or corticosteroid use. These are your pre-procedure evaluation and preparation steps. During the consultation, you will need to set expectations and explain what PRP or PRF can realistically achieve. Discuss potential results, review before and after photos, and explain both the benefits and risks. Make sure to answer all patient questions and get informed consent. Now, do a full medical review, including chronic illnesses, medication, and any past treatments. Evaluate their skin type, elasticity, and any scars or lesions that can affect the outcome. Pre-treatment guidelines include medication and supplement review, patients to stop taking NSAIDs, aspirin, and supplements that increase bleeding risk, like even vitamin E and fish oil. Lifestyle, you want your patient to stay hydrated, avoid alcohol and caffeine, and stop smoking at least 2 weeks before the treatment. Sun exposure, you need to advise your patients to stay out of the sun before treatment for best possible results. PRP and PRF preparation techniques. First step, blood collection and handling. Venipuncture techniques. Patient prep. Before you even stick that needle in, make sure that your patient is hydrated and relaxed. Hydration directly impacts the quality of blood you're drawing. If they're tense or dehydrated, the process gets more difficult, and you don't want them fainting halfway through, so comfort is key. Sterile technique. Sterile, always sterile. Use gloves, disinfect the area properly with alcohol, and don't rush. Cutting corners here will lead to contamination, and that's going to be a headache later on. Needle selection. You'll want to use a 21 to 23 gauge butterfly needle or a vacutainer system. Why? Because it minimizes patient discomfort and reduces hemolysis. The last thing you need is broken red blood cells messing up your sample. Volume of blood. Here's where precision comes into play. Depending on the area you're treating, you'll typically draw 10 to 20 mLs of blood per session. More blood for larger areas like scalp treatment, and less for smaller areas. Anticoagulant used for PRP. Now, PRP needs anticoagulant. Why? Because we don't want the blood clotting before we process it. The whole process is to keep blood fluid so that we can isolate those platelets. As soon as you collect the blood, you're going to mix it with an anticoagulant like sodium citrate or ACD. Gently invert the tube a few times to mix, but don't shake it. We don't want to prevent clotting without damaging the platelets. No anticoagulants for PRF. Here's where PRF differs. With PRF, you actually want the blood to clot because that's what's forming the fibrin matrix, a key feature of PRF. Collect the blood in a plain glass or silica-coated tubes without any anticoagulants. Speed is key here. Process the blood immediately to prevent premature clotting before centrifugation. PRP centrifugation methods. Now we're getting into the fun part. This is where we separate the plasma from everything else and concentrate the platelets. There are two main methods, single spin and double spin. In the single spin method, this is a simpler method, but it doesn't give you the highest concentration of platelets. The process is to spin the blood at a high speed, like 3000 RPM for about 10 minutes. What you're doing here is separating the plasma from the red blood cell and buffy coat. The plasma you get is PRP, but it's only moderately concentrated with platelets. Now, the double spin is if you want to maximize the platelet concentration. First spin, you'll spin at a lower speed, like 1500 RPM for 10 minutes. That separates out the plasma, buffy coat, and the red blood cell. Second spin, you'll collect the plasma and the buffy coat and spin it again at a higher speed, like 3000 RPM for 10 minutes. This pushes the platelets to the bottom of the tube, giving you a super concentrated PRP. Equipment and devices. Centrifuge. You want to invest in a high quality adjustable speed centrifuge. If you cheap out here, you're going to get inconsistent results. Make sure it's calibrated regularly too. PRP kits. There are commercial PRP kits that make your life easier. They provide standardized tubes, protocols, and everything you need for a consistent outcome. PRF centrifugation methods. PRF is a bit different because we want a clot. It's a simple centrifugation process. The procedure is to spin the blood at a lower speed for a longer time. For example, 12 minutes at 2,700 RPM. You can tweak these settings depending on the equipment, but the idea is to form a clot while preserving platelets and leukocytes. The outcome is what you get is a middle layer, a fibrin clot between red blood cells and plasma. That's what you're after because it's packed with platelets and leukocytes. Creating the fibrin matrix. Now, you want to carefully extract out the fibrin clot without disturbing the red blood cells at the bottom. You don't want contamination from the red blood cell layer. Centrifugation parameters. The way you spin the blood affects how many platelets you capture. You can adjust the speed and duration to get best yields depending on the patient. Buffy coat inclusion. If you include the buffy coat in your final collection, you'll get a higher platelet count. It's loaded with platelets and leukocytes. Use of activating agents. The purpose is to activate the release of growth factors faster. You'll typically use calcium chloride, thrombin, or even mechanical agitation to activate the PRP. The procedure is to mix the activator with PRP right before the application, and you got an active healing solution right away. Here are other advanced PRF and injectable PRF protocols. These are the more advanced variations of PRF designed to improve cell retention and growth factor release. Advanced PRF preparation option 1 is this. We're using a lower centrifugation force here to retain more cells. You'll spin at 1,500 RPMs for 14 minutes. This retains more neutrophils, lymphocytes, and platelets, all key players in the healing process. An alternative PRF is lower the speed even more to 1,300 RPM for 14 minutes for even more viable cells. It's all about getting the most out of that fibrin matrix. A second advanced PRF preparation option is to change the speed and time even more to boost growth factor release. You can spin at 1,300 RPMs for 8 minutes, which traps more leukocytes and boosts the release of growth factors like TGF-beta, VEGF, and PDGF. Now, in injectable PRFs, you'll want to do a different protocol. This is if you want to use PRF that can be injected, for example, in the nasal jugal or under eye area. This injectable PRF protocol is very simple. You'll spin the blood without anticoagulants at 700 RPMs for 3 minutes in a plastic tube. This delays coagulation and gives you a liquid form of PRF that's ready for injection. Procedure protocols. Now that you got your PRP and PRF ready, let's talk about how to use it. Sterilization and safety standards. Aseptic techniques. You got to maintain strict sterile conditions. Wash your hands, wear gloves, and make sure your instruments are sterile. Infection control measures. Disinfect the treatment area thoroughly with an antiseptic solution. Use a disposable material wherever possible. Step-by-step procedure. PRP preparation. Once the blood is processed, PRP is ready to go. You want to use a fine gauge needle, 27 to a 30 gauge, for PRP injection. The depth of the injection will depend on the area you're treating. For hair restoration, it's a scalp deep. For skin rejuvenation, you want to stay superficial. Microneedling with PRP. Device preparation. You want to sterilize a microneedling device and use a single-use cartridge. No excuses. Procedure is to clean and numb, perform microneedling, and immediately apply PRP so it penetrates through the microchannels. PRP for hair restoration. You want to prep the scalp by cleaning and disinfecting. Apply topical anesthetics if needed. And then you inject PRP into the scalp, spacing injections about 1 centimeter apart. You want to massage the area afterwards to distribute the PRP evenly. Pain management strategies. Topical anesthetics. Apply 30 minutes before your treatment, and this will reduce discomfort, especially for microneedling or hair restoration procedures. Local anesthesia. This is for deeper treatments or sensitive patients. You can inject anesthesia or perform a nerve block for patient comfort. Post-procedure care and patient instructions. Managing initial reaction. Right after a PRP or PRF treatment, your patients are going to have some initial reaction, and that's normal. First, patients may experience swelling and redness. Almost every patient will get a little swelling and redness at the treatment site. That's normal. Grab a cold compress and get it on there. You don't want to overdo the cold. Do it intermittently for the first few hours and not just one long cold session. Minor bleeding is expected. There's a little bleeding at the injection site. It's not a big problem. Apply gentle pressure with a sterile gauze until it stops. You don't want to scrub or wipe down aggressively. You're just controlling the bleeding, not creating a wound. Pain management. Now here's a key point. No NSAIDs. You want to stick to Tylenol or acetaminophen. NSAIDs can interfere with the healing process by messing with the platelets. You need those platelets to do their job. So steer your patients away from ibuprofen or aspirin for at least a few days. Monitor for complications. 99% of the time, things will go smoothly, but you got to have an observation period right after the procedure. You want to keep the patients for about 30 minutes post-procedure to monitor for any immediate reaction. Signs and infections. You want to train your patients to look out for red flags such as redness, warmth, pain, swelling beyond what's normal, or any discharge. If any of that happens, you need to get a call ASAP and prescribe antibiotics. Allergic reactions. Although super rare, you got to keep an eye out for allergic reactions. Look for rashes, itching, or breathing issues. And your team should have an emergency protocol in place just in case. Home care instructions for parents. This part is crucial because if your patients don't follow your instructions to the letter, all the work you did could just go out the window. Activity restrictions. Rest. First, tell your patients to relax. No strenuous activity for at least 24 hours, including working out, heavy lifting, or anything that's going to increase blood flow too much. Avoid sun exposure. No sunbathing, no tanning beds. The treated skin is vulnerable. The last thing you need is pigmentation changes from sun exposure. Remind them to avoid direct sunlight for at least a few days and wear sunscreen when they go out. No alcohol or smoking. This is big. Alcohol and smoking impair healing, period. Tell them no drinking or smoking for at least 48 hours if they want to optimize their results. Skin and hair care recommendations. Cleaning. Be gentle here. No scrubbing, no abrasive cleaners. They should use a mild, non-abrasive cleanser with lukewarm water. Stay away from hot water or harsh chemicals for a few days. Moisturization. Moisturize, but with a gentle hydrating product. Nothing with active ingredients like retinoids, glycolic acid, or salicylic acid. These are too harsh right after the treatment. Avoid makeup. For at least 24 hours, no makeup. It's a big infection risk, especially if they're treating the face. After 24 hours, they can return to their usual routine. But again, steer clear of harsh products for a few days. Hair care, post-scalp treatment. If you're treating the scalp for hair restoration, They need to avoid washing their hair for at least 24 hours. After that, they should use a gentle shampoo, nothing too harsh. Managing side effects and complications. Common side effects include swelling and bruising. This is very normal. These will go down in a few days. Cold compresses help, and you can recommend arnica gel if they need it. A little tenderness at the injection site is totally normal. It'll resolve within a couple of days. Itching and dryness can also happen. A simple fix is a gentle moisturizer. Emergency response protocols. This is the part where you tell them what's not normal. Severe pain and swelling. If patients experience severe pain and swelling, tell them to call you immediately. This could be a sign of infection or something more serious. Adverse reactions. You need to provide every patient with an emergency contact number and make sure they understand that if they're having trouble breathing, significant swelling, or any other red flags for them, they need to seek help first. Follow-up schedule. You've got to have a follow-up plan in place. This isn't a one and done deal. Initial follow-up. Schedule initial follow-up within 1 to 2 weeks post-procedure. You want to check in on how they're healing and answer any questions they might have. Subsequent visits. Depending on the condition, you might need to see them every 4 to 6 weeks for progress monitoring, and if needed, additional treatments. Long-term care and maintenance. The results of PRP and PRF are not permanent, so you need to have a long-term game plan for your patients. Some conditions will need maintenance treatments every 6 to 12 months to sustain the results. You have to be upfront about this. Lifestyle and skin regimen. Here's where the healthy lifestyle pays off. Recommend they keep up with solid skincare routine, using sunscreen, antioxidants, and moisturizers to keep the skin in top shape. Healthy living, including a balanced diet, regular exercise, staying hydrated. These aren't just good general advice. They directly impact the skin and the hair's ability to heal and regenerate. Make sure that your patients know that. Combination therapies and advanced techniques. If you really want to take your PRP, PRF game to the next level, you have to understand how to combine these treatments with other modalities. Microneedling and PRP and PRF. One of the most powerful combos you got in your toolkit is microneedling. Microneedling creates controlled micro injuries in the skin, which primes it for PRP or PRF. Here's the protocol. The procedure is, after microneedling, apply PRP or PRF topically. The microchannels created by the microneedling allows for deeper penetration of growth factors. This promotes collagen production and skin regeneration at a much higher rate than either treatment alone. The benefit is that you'll see enhanced skin texture, reduction of fine lines, faster healing. It's night and day compared to microneedling on its own. Laser therapy and PRP. This is another powerhouse combo. You're basically supercharging the skin's healing process. Procedure is to perform your laser treatment first, whether it's fractional CO2, erbium. This creates a controlled injury to the skin. Immediately after, you can apply PRP or PRF to accelerate the healing. The benefit is that you'll reduce downtime, improve skin tone, faster healing, and overall enhanced results. PRP and PRF also helps reduce the risk of post-inflammatory hyperpigmentation. While there's some evidence on this, keep in mind it's still not fully proven. Topical treatments with PRP and PRF. They can be also combined with topical treatments to amplify their effects. The procedure is to apply topical treatments like retinoids, hyaluronic acid, then follow up with PRP or PRF. The idea is to enhance the absorption and effectiveness of the topicals. The benefit is to improve hydration, enhance penetration of active ingredients, and better overall results. keep in mind, once again, the evidence here is mostly anecdotal. Integration with aesthetic procedures such as dermal fillers. When you're doing fillers for facial volumization, adding PRP and PRF can take the results to the next level. You'll want to inject dermal filler first, then follow up with PRP or PRF in the same or adjacent areas. This boosts skin texture and tone while prolonging the filler effects. This way, you're not just adding volume, you're improving the overall skin health and appearance. You could also combine this with botulinum toxin. The botulinum toxin handles the dynamic wrinkles. PRP and PRF takes care of the skin quality. The procedure is to inject botulinum toxin to relax the facial muscles, then apply PRP or PRF topically or via microinjections to improve skin texture. This way, you're tackling both wrinkles and skin quality. Together, it's a winning combo for facial rejuvenation. In the last few years, PRP and PRF technology has advanced leaps and bounds. Centrifugation techniques, we're now able to fine-tune the speed and time of centrifugation to get better platelet and growth factor concentrations. This means better results for your patients. Activation methods. The way we activate PRP has improved. We're seeing more efficient and bioavailable PRP and PRF, which means stronger results. Customized formulations. While it's still evolving, the idea that by customizing the formula, we can get more specific and effective outcomes. Now, let's talk about running a PRP, PRF practice efficiently and ethically. This is just as important as the treatment themselves. PRP and PRF have been through many clinical trials. Here are some key takeaways. Skin rejuvenation. Studies show that PRP significantly improves skin texture, elasticity, and reduces wrinkles, especially when combined with other treatments like microneedling or lasers. Hair restoration. Clinical trials have shown that PRP is highly effective for treating alopecia, increasing both hair density and thickness. Wound healing. PRP and PRF accelerate wound healing and tissue regeneration, making them great post-surgery or for chronic wounds. Comparative studies. PRP versus corticosteroids. PRP offers long-lasting pain relief and functional improvement for orthopedic conditions compared to corticosteroids. PRP versus hyaluronic acid fillers. While both improve skin quality, PRP gives the additional regenerative benefit by stimulating collagen production. It's more gradual compared to the immediate effects of fillers. Incorporating PRP and PRF services into your practice. To make PRP and PRF successful in your practice, you got to think business. First, market research. Know your local market. Understand what your patients want, whether it's skin rejuvenation, hair restoration, or pain management. Service packages. Bundle treatments to offer comprehensive solutions. For example, combine PRP with microneedling or fillers for full spectrum facial rejuvenation. Educational campaigns. Use social media, host seminars, whatever it takes to educate potential patients about the benefits of PRP and PRF. Staff training and education. Make sure your staff knows the ins and outs of PRP and PRF preparation and application. They should be as skilled as you in handling these treatments. This field is evolving fast. You and your staff need to stay updated through workshops, conference, and new research. Setting patient expectations. The key to happy patients is setting the right expectations upfront. Clear explanation. Don't overpromise. Let patients know exactly what to expect from the procedure and what results are realistic. Visual aids such as before and after photos, videos, anything that helps patients visualize the potential outcome is super helpful. legal and ethical issues. Make sure your licenses are all in place and you're following all clinical protocols and safety procedures. You want a reputation for being thorough and safe. Always be truthful in your advertising. PRP and PRF can do a lot, but it's not magic. Set realistic expectations in your marketing materials. This is the intro to PRP and PRF training for medical providers. This is Dr. J. Park with Cosmetic PRP Training. If you have any additional questions or comments, please reach out to us. Thank you very much.